Well, you're watching Morning Live on SABC2. Just that question, Peter from Sifundo Jiba, who says, how far is the province of KwaZulu-Natal to the Health MEC? How far is the province with the registration of health promotion with the Health Professions Council of South Africa as they plan to introduce it?
All right, here's my questions to you now. Hulisani Makesha is asking, what is the Premier doing about the high rate of HIV and AIDS, as well as unemployment, especially amongst the youth in the province? That's one question. I think you did answer that question, but perhaps maybe just a little bit, perhaps a bit more detail on that. Retabile Nshinga saying, what was the outcome? This is what you did. I beg your pardon, I know that you asked that question. And then this is another one from Linda Umpi saying, what is the Premier doing about the rape statistics in the province? KZN has the highest rape stats per stats in SA. How do we avoid this? Now, that's Linda. Rape in KwaZulu-Natal, HIV, AIDS and unemployment. Some of the issues to be addressed.
Peter?
All right, thank you very much indeed, Vuya and Leanne. MEC for Health, how far are we with the registration process? I think they talked about there's a registration process I'm sure you're aware of. All right, let's go back to Vuya. Vuya in studio, can you just repeat that first question about the registration?
Okay. All right, Peter. It comes from Jiba, Sifundo Jiba, who says, to the Health MEC, how far is the province with the registration of health promotion with the Health Professions Council as the province, it would appear, is planning on introducing it?
Okay, all right. MEC?
I didn't really follow that question very well, but in terms of health promotion, maybe the questions must be around the issues of primary health care, because that is where we actually are talking about health promotion. The NHI program is actually speaking directly to that, to say we do not want to get people to fall sick, only then we start treating them, and also because it's very expensive. But the health promotion that is actually envisaged by the NHI is actually to say, let's get to the communities, and we are doing successfully well in the province. It will actually piggyback on the already program that we call Operation Suma Sake, because we want to go to the community and say, everybody here thinks that they are well, they are healthy, but let us do certain programs to actually make sure and benchmark that there is health. So that is health promotion, talking about actually, but it also boils down, I'm glad there's all mayors here, health promotion cannot be taken away from providing safe and clean water, providing sanitation, because of all that. So it's intertwined, and our Operation Suma Sake war rooms talk to that, because we can now only say, while we have done that well, but there is a problem of diarrhea in this area, could it be related to poor sanitation, absence of water? So that is already embedded in our NHI, and I think it's going to actually kick off well with our Operation Suma Sake in the province.
This province also is one that's had traditionally, and I'm not sure what the status is now, HIV prevalence was problematic. How are we in terms of dealing with HIV in the province?
There's been success stories in this province, and also covered very well in the state of the province addressed by the Premier. Just to give you an indication, in 2007, we had a 19% PMTCT program, that is a transmission of a virus from a mother to a child. It means out of 100 women who came into our clinics, almost 20 of those mothers would transmit a virus to a baby. And those figures went down in 2009 to 10%. And just last year, we are sitting now at 2.1%, having overtaken even provinces that actually have a lowest prevalence on on HIV, like Western Cape and all other provinces. In fact, we are sitting at number 1 in terms of HIV prevalence in the country, but we have reduced, and we are sitting as number last in terms of transmission of a virus from a mother to child. Of course, there's been a vigorous program in this province that a third of the 1.7 million South Africans who are on treatment, a third of those are located in one province, and that province happens to be KwaZulu-Natal. A lot of other issues that have come in there, We do not have any more South Africans in this province waiting to be put on a program. We actually diagnosed you to be HIV positive this week. Next week, we start you on treatment, largely because of other programs that we have also maybe taken to the whole country called roving teams to say, don't wait at King Edward at Ngwelezane Hospital. Go out there to the other outlying clinics and initiate other patients so that the waiting time is reduced, not only just in one hospital, but countrywide. Of course, there's a report that is coming from the Old Mutual this year, supported by the MRC study, that says there has been an increase in the life expectancy of South Africans from 56 years to now 60 years. And largely, they are also saying they are seeing a reduction in terms of life cover claims because people in South Africa are no more dying. Why? Because they are on treatment. So that is also a positive impact, but that we need to give to our society to say, if you come forward, we give you ARVs, there's a process now of getting you to actually continue on treatment and you don't fall sick and die.
All right, okay. MEC Tusi, I'm going to ask you to address this next question partly, and maybe another MEC will add to this. Meli SABC, where are you? Oh, there we go. All right.
My name is Meli SABC from the Impendulo Youth Institute.
Speak with a big voice. Do not be afraid.
My name is Meli SABC from the Impendulo Youth Institute. With over 150 to 200,000 students that are in various tertiary institutions across the province, we are there in our institutions. However, we are suffering from all forms of social ills, and moreover, we are suffering from various challenges and difficulties, despite the fact that we've been given an opportunity that we recognize as a privilege to be in tertiary institutions. However, we are saying that being ravaged by all sorts of these social ills, we feel as if we are not getting any particular support in order to be able to deal with them because, as you would know, that the Department of Higher Education and Training regards it as their competency to deal with us. But on the other side, basic education as well feels that once we're out of the basic education or high schools, we're no longer their responsibility. So we are somehow stuck in the middle, and we are well aware that in terms of the consequences, we end up being a burden on the province, whether we are involved in car accidents, we're involved in drugs, whether we're involved in various other forms. And we would like to know that how could the provincial government assist us to be able to deal with this particular challenge?
All right. So what he didn't add, what's on this question as well, is the social ills such as hunger, poverty, disease are problematic for students as well. So they almost fit in various departments, and some of the issues are not quite dealt with. Your thoughts?
Thank you, Peter. Yes, it is true, our province is faced with the challenge of social ills. As you are saying, the young people are also involved. We have a program that goes directly to the young people to address all these ills, especially the young people who are in the tertiary institutions. We have a program that is going to be going. We haven't started yet, and fortunately, the speaker is part of the program. We will be going to tertiary institutions to address these issues with the young people in the tertiary institutions. We are taking the Department of Social Development to the young people, to the communities, and to almost everywhere. And the department in dealing with the social ills that are out there, we have a program working together with the other departments like the Department of Cooperative Governance and Traditional Affairs, Community Safety and Liaison, the Department of Health, Arts and Culture, Sports and Recreation. The program Azibuye is Emasisweni. We are in collaboration with the House of Traditional Leadership, Religious Leadership, and of course all the NGOs that are out there that are assisting us in fighting all the social ills. We are going from district to district, and of course nearer to the schools and also into the tertiary institutions. We also have a program that is trying to assist the young people who are out there. Some of them are school dropouts, some of them are from prison, ex-prisoners, some of them are just out of the foster care grant system, and some of them have been abusing drugs, and now they want to come clean. We have a program of establishing youth academies. We've just opened one in Esikabazini, where we keep the young people for 3 months, intense training on leadership, discipline, and of course we give them skills like plumbing, welding, and all the other skills, so that they are able to survive and are able to make sure that they keep their families and the communities are looked after by these young people who are out of these youth academies. And we're rolling out the program to all the other districts. The next one will be in Vuma, in Utungulu. The next one, Amajuba. The next one will be Umgumundlovu. All the districts will have these youth academies. And of course, we will be going to the institutions, the tertiary institutions. As we had said, we will roll out the program to all the tertiary institutions to fight all the social ills. And the program of Azibuye Masisweni is saying to the communities, let's go back to basics, asibuyiseni ubuntu, so that we're all able to look after each other. Communities are able to support each other. Whether a family is a poor family, we're all able to assist and make sure that everybody in this province is well protected and is safe. Thank you.
All right, we're talking about safety. I think the rape issue is one that affects a number of you as MECs at one level or another. Perhaps you, MEC Tusi, in terms of how you manage people, post-rape, dealing with them in terms of warning and changing behavior around how we view rape and what role men can play in terms of fighting the scourge. If you could share your thoughts with us and what the province is doing.
In this province, Peter, we are working together as this government and the communities. We have different forums like the Men's Forum, Religious Leadership, Amakosi, the NGOs. We're trying to go to communities and create that awareness about rape. But we do have victim empowerment programs. Just last week, together with the Minister Jeff Hadebe, we launched another program, which is an addition to the Tutuzela centers, where the rape victims are taken care of. We want to make sure that everybody is aware when they get to these centers, they're given information, they're given the care, they're given the support. And when they go back to the communities, we're able to make sure that we continue giving support to the victims. And we are calling on all the communities to work together with us to make sure that everybody is aware and we protect each other in our communities.
All right, we're going to take a quick break just now, but just before that, MEC Mkhunu, perhaps rape statistics, alarming, is the sense that I'm getting from the tweets that's come through. What are we doing to manage that?
Well, as it has been indicated, there are two departments in particular whose task it is to intervene. It is the Department of Social Development on the social side. On the criminal side, we, as the Department of Community Safety, work with the police to identify, because rape is a criminal act. And therefore, we have to ensure that police do act and deal with the arrest of those people. But at the same time, as the Department of Community Safety, we also do have campaigns that are formed in terms of what we say is Operation Kuzumhlola. And that is where we go out there to galvanize the communities to act against those who are would-be rapists or those who have raped. Because, you know, the rape is a very, very queer thing. It happens in the communities and in many cases happens in the family. Now, we must deal with society at that level of community and at the family level to isolate or identify the so-called rapists. And those operations are run together now with the Department of Social Development and COGTA and the Department of Health. And we have found that the more you involve communities, the more they take responsibility for amongst themselves to identify youngsters or even those people who are adults who have tendencies of being abusers.
Okay, on that note, we will take a quick break, and then when we come back, Vivian Reddy is going to be posing a question. Stay with us, and you two at home can take part.